Dementia is a loss of brain function that occurs with certain diseases. It affects memory, thinking, language, judgment, and behavior. Alzheimer's disease, the most common type of dementia, accounts for 60 to 80% of all dementia cases reported. But did you know that there are over 50 different types of dementia, and each of them can affect the body differently? This episode of Healthy Connections will give an overview of what dementia is and remind you that dementia is not a normal part of aging, as well as highlighting some incredible advances that are being made in the world of possibly one day preventing dementia. Hello and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned for Healthy Connections. Dr. Tamika Haynes Robinson, a neuropsychologist with Orlando Health, is here to begin our discussion on Alzheimer's and other types of dementia. Thank you, Dr. Haynes.
Thank you for having me.
What does a neuropsychologist do?
Well, the neuropsychologist studies the relationship between your brain and your behavior. So primarily we conduct assessments for any array of neurological disorders to help with diagnosis and then plan treatment and rehabilitation.
So for our discussion today, we're talking about dementia in all of its forms. Can you define dementia versus Alzheimer's versus, just kind of take us through a basic primer of that, please?
Sure. So you can think of dementia as an umbrella, and the different spokes of that umbrella are the different types of dementia. Alzheimer's is one, it's probably the most famous one. Mm-hmm. And then there are others such as vascular dementia, there's Lewy body dementia.
So let's take them one at a time. What is vascular dementia?
Vascular dementia is more likely to be caused by a history of vascular disease, a stroke, as well as ischemic changes in the brain, meaning the small vessels in the brain are not working as well as they should.
Okay.
It can also be caused by long-standing heart disease. And there are different kinds of dementia, but generally it is known as a progressive neurological disorder, which means it gets worse with time and it's incurable.
And that is the piece that we're all hoping will change. You know, you mentioned Lewy body. What is that?
That's a different kind of dementia. I think the most famous person that was diagnosed with it is no longer with us, Robin Williams. He was diagnosed with Lewy body dementia, and it's a very aggressive form where you forget to do things that you already know how to do. You may have behavioral disturbances, you may have visual disturbances, changes in your ability to regulate your body the way you used to.
Okay. This isn't something that you just wake up one morning and these symptoms are there.
Not necessarily. That is a rarer case. So for example, people may notice changes in their memory and thinking skills shortly after a stroke or a seizure, for example. But for it to be considered a progressive neurological disorder, it has to have the same pattern over time and decrease your cognitive functioning over time.
We're hearing about younger and younger people being diagnosed. Is that a trend that you're noticing as well, or is that just getting more attention than it used to?
Well, there's a number of factors that are contributing to that. One, our diagnostic skills are getting better and better, and the criteria for the diagnosis is including more people than it probably would have before. Also, people are being made more aware of some of the early symptoms, so they may be coming in earlier, or maybe their job has sent them in earlier, noticing that there are changes. And also that some viruses, especially COVID-19, in our early research is showing that it may kind of accelerate symptoms of a cognitive impairment that may have been there already, but kind of made it worse.
So we really need to pay attention to things. So let's talk about what we need to pay attention to. What are some symptoms that we need to notice?
Well, what you must be most aware of is a pattern. So everybody forgets where they park the car.
Or where they put their keys.
Or where they put their keys.
Right.
However, what you want to notice is a pattern of forgetfulness. You may not notice it, maybe your spouse or your family members may notice it, or your coworkers may notice it, that you're consistently not being able to do the things you used to do.
Okay.
You can't remember how to get into your computer to a program you use every day, for example. Or you're having more difficulties remembering the list of things you have to do for the day, and you keep having to refer to them. Simple things like even preparing a familiar meal you've done a million times, and now you're thinking, well, what comes next? What goes in it? You forget what's on it. A common one that I get is I keep forgetting that I'm making something and I burn it. And that's when they're like, wait, something is not quite right. Or something at work, maybe a supervisor comes in and says, you've forgotten to do this a number of times. And it's something you would do every day. Something is up.
So are you encouraged or kind of feeling like you're hitting your head against a brick wall when it comes to progress in this area?
Well, right now, I mean, there are significant advances in understanding the aging brain as a whole, and understanding that dementia is not normal aging.
Okay.
It's a disease. So everybody experiences forgetfulness as they age. However, dementia is far more advanced than what we would expect.
It's like you said, it's patterns you're looking for, not just simple forgetfulness.
And it's more than memory. I want to make sure you understand. It's also things like problem solving, remembering how to get to where you're going, paying attention, concentrating, decision making, judgment. I hear a lot of cases, family members bring their family members in to say, you know, they're being scammed quite easily on the phone, for example, whereas that would never have happened before.
Or feeling someone is moving things.
Exactly. Some amount of paranoia when that wasn't the case, or you might find that they've started to hoard things. That's another behavioral change that people notice in their family members. They hide things from people, they hide things and then forget where they've put it, and then they get really upset about the fact that they can't find it.
So for someone listening for whom light bulbs are going off right now, what is the first thing they should do?
Well, I would get in touch with a primary care physician. So if they have a physician that normally looks after them, they need to put that to their attention. And usually that's the beginning of the pathway for access to different kinds of tests to see if this is normal aging or if something else is happening.
You said something before we started taping that by the time the symptoms show up, this disease has already progressed maybe 20 years.
Yes, so we've discovered in the last 10 years or so that dementia is really the end stage of a process that likely began in your 40s.
So that's why it's important now. If you notice something, talk to your doctor and start getting the help as soon as you possibly can.
Yes, and there's no cure, but there are medications that can help to kind of prolong where you are and to reduce some of the inflammation that might be causing this. But
and your work is key, so thank you for sharing with us
you're
today.
Welcome.
We will be back right after this. The Advent Health Memory Care Clinic is the 16th state-designated memory disorder clinic in the country, dedicated to promoting lifelong brain health. Stephanie Mullally is here to tell us more about that program. Thanks for being here.
Thank you for having me.
Now, we just heard the definition of dementia in all of its forms. By the time someone gets to a memory care clinic, walk us through that gap between diagnosis and getting to you.
We do assist with the diagnosis and treatment aspect. So once an individual is meeting with their primary care doctor, noticing changes, or the family's noticing changes with memory, confusion, behavior, things of that nature, a lot of times we will get referrals from the primary care doctors for further treatment. Or it can be the family realizing something's different and reaching out from the community and us connecting them to the clinic, where our provider does a thorough memory testing, thorough assessment, family history to further assess, provide lab orders, CAT scans, things of that nature to really get to a diagnosis and find out what stage this individual is at of that diagnosis.
Now, this is a walk-in. It's not a long-term or overnight kind of facility.
Correct.
Outpatient.
Correct.
Okay.
Correct. We are outpatient clinic specializing with memory, Alzheimer's, and all the other related dementias.
Now, we said the 16th state designated clinic. What is the difference between one that's designated by a state and one that's not?
With our state designation, we receive additional funding from the state of Florida Department of Elder Affairs to be able to assist towards the clinic and our program, so we're able to continue providing the care and to do more and continue to grow.
So who's eligible to be a part who's eligible to take part in the services you offer?
So our clinic specifically works with the geriatric population, so 62 years and older with any concerns with memory impairment.
What happens in a memory care clinic? I mean, we've heard the term memory care, but what exactly do you do? Can you walk us through that process?
Sure.
What happens to our loved one or us if we walk through the door?
Well, definitely the patient, of course, is very involved with the appointment, but as well as the family or the caregiver. So a lot of times with our new patient appointments, they're normally about an hour and a half long because we're really getting the information, getting the history, getting information from the patient and the family, doing any memory testing, and ordering any additional lab work, CAT scans, neuropsychology assessments, things of that nature.
Sounds extremely thorough.
It is, because we really want to get that great assessment to be able to diagnose and have a plan of action for treatment. We also have a social work component as part of the clinic. My counterpart, Tiffany, is the clinic lead, so she provides additional support to the caregivers and patients from doing a psychosocial assessment.
What is that, a psychosocial assessment?
So it's looking at the history, if there's advanced directives in place,
okay,
who the individual lives with, their functioning level from being able to dress themselves, eat on their own. Driving is a top question that we ask because it is safety related. And then looking at the family, the caregiver's needs. So we're able to provide resources and educate on topics related to dementia.
So it's not just for the patient, it's for the group of people, the team, the family, who is also going through this process with them, because
Correct.
Everybody's going through this process. So what kinds of things do you do for caregivers?
So we do offer, for the community outreach component, we have support groups for the caregivers, and then for the caregivers and the patient themselves, and honestly the community, we have the support group, we have music programs, exercise programs, brain health programs, and those are at no cost. They are free to the individuals that are interested.
What's the difference between memory care and brain health programs?
That is a good question. They all really correlate because, we look at memory care clinic, and that's looking at the treatment, that continuum of care, the diagnosis, the assessing. But that correlates into brain health, right? Because we want that prevention, that early detection. So all the programs that we offer really help or the goal is to help the individual stay active, keep their brain active, socializing, and then also be a support for the caregivers. As you know, the caregivers can join the programs, but if they need that hour to maybe do things around the house or things of that nature, it can give them an opportunity to be in the home while the program's happening, because a lot of them are virtual, while the individual is participating.
What's the biggest misconception people have about what you do there, or the things that you can or can't do for their loved one?
We see denial is the biggest thing that we have to address, which is understandable because dementia is a tough and scary diagnosis, not only for the patient being diagnosed, but for their caregiver. You know, watching our loved one change as the disease progresses is not easy all the way around. So we have challenges at times because the acceptance is not there initially. But as we continue to see the patient, the family, continue to educate, provide that support, with baby steps, we do, you know, make progress, and they start to realize, okay, this is really happening. We have a diagnosis. How do we need to proceed?
Well, it sounds like your approach is extremely holistic.
Yes.
Thank you for the work that you do, Stephanie.
Thank you so much.
More to come. Stay with us. Learning that a loved one has been diagnosed with Alzheimer's disease or another form of dementia is life-changing and often overwhelming. What do you do next? How do you cope? Where do you turn? Well, Edith Gendron from the Alzheimer's and Dementia Resource Center is here to answer those questions and talk about much more. Thank you for being here.
Oh, thank you for having me.
This disease is cruel, to say the very least, and sometimes more difficult for the caregivers because you watch the person fade away a little bit at a time. What do you tell someone when their loved one has been diagnosed and they find out about you and they go, help?
Help. It depends, of course, on the specific circumstances of that caregiving family. Maybe the caregiver, the care partner, the primary is still working. Maybe it's the proverbial couple where they've retired and they expected their retirement to be different. So what we say first is, we're here. You're not in this alone. One of the things that is very important is to learn as much as you can about the particular form of dementia your person has, because Alzheimer's disease differs greatly from Lewy body dementia, that differs greatly from vascular, and then from frontal temporal, and then there's subcategories of those. So one of the things we usually ask first is, who said your person has, and then fill in the blank.
Okay.
Right? Because that matters. You must work hard to be diagnosed by a full team, as we call them memory disorder clinics. Advent Health has one, Orlando Health has one, Cracker Jack teams. They will determine what type of dementia your person has right now.
So you just freed a lot of people who think one diagnosis means, you know, we're only going down this path for what we do. So how do you provide services at the center? I mean, if someone walks in the door, they've already found out, what happens next?
Right. The perfect world solution is, first we have something called a care coaching. And it's important for me to say, and I forget to say it all the time, is we never charge our families for any service. So we have a care coaching. That's private, that's one-on-one. It's you and I talk about your personal circumstances, and you come away with at least next steps, if not a year-long plan, 6-month-long plan. Again, in that perfect world, you'll come back as things change, because things will change, period. They will change. We also try to provide the families the care partner, if you will, with strategies that are specific to their person. My mom won't take a bath anymore. Well, that's an indicator of progression, and she probably won't take a bath anymore because it hurts. The water striking her skin hurts. So let's talk about some products that work well, right? Those sorts of things. We have support groups. We have specific support groups for men, for adult daughters, adult granddaughters, young onset, Spanish speaking. So we try to address that need. We have any number of workshops that deal with specifics.
Now,
right?
you said something, young onset. Are you seeing more and more younger people who we don't typically think would be diagnosed?
Absolutely. We know, of course, that frontal temporal dementia is a disease of younger people. However, very quickly, we at ADRC thought, well, you know, this is our work, this is our vocation, so that's why we're seeing younger people. This is what we do. And then we learned from a Blue Cross Blue Shield report between the years of 2013 and 2017, a 131% increase in the diagnosing
Oh my goodness.
of young onset. And that's significant because we said diagnosing, not suspected, not guessing. And we're talking about persons 64 and younger. We're seeing people as young as 40, 42, 43. It's a whole
So
different...
this is not just mom and dad and your grandparents.
Oh no, this is a whole different ballgame.
So where does one go if you suspect something is amiss? Where do you go to get diagnosed?
It's going to depend on your insurance, of course. Most people, remember the young people don't, most people have Medicare, and Medicare will pay for that long battery of tests, and it should be hours long through the memory disorder clinics.
Okay.
And again, we have one at Advent Health and we have one at Orlando Health.
So now we have two powerhouse health
Right, two
institutions.
excellent places.
Why did you get involved?
Well, it's a culmination of everything I've done in the past. I've always loved elders, older people. Started out as a child, a little kid in a nursing home. My aunt and my mother worked there. They were my first friends. And then, you know, started, first professional work was in a nursing home. My grandmother developed a form of dementia. Undiagnosed, but now knowing what I know, I'm as sure as I can be, it was vascular dementia. In my modern life, if you will, my brother-in-law developed young onset, and it was so rugged. You know, he was at the peak of his career. His wife was dying of cancer. He had a granddaughter that he was responsible for, a disabled child that he was responsible
And
for.
you stepped in and said, this is part of what I'm here to do.
The experience of that translated into our paying closer attention to that, again, in our world here.
Well, thank you for your work at the center. I wish we had hours to talk about this, but the key thing is people need to make sure they're diagnosed and diagnosed correctly, and there is help available.
We are here.
Great. Perfect last words. We'll be back with more. Stay with us. Robin Roundtree is here to share her journey as a caregiver. She's also employed by the Alzheimer's and Dementia Resource Center. What was that like for you, Robin? I mean, it's tough when we get that diagnosis for someone we care about, and then the relationship completely changes.
The hardest thing I've ever done, and I don't think I'll ever do anything harder. I hope nothing harder comes along. The diagnosis came. She was in Ohio, and we
this
kept
is your
saying,
mother.
"This is my mother, Joyce." She was diagnosed with Lewy body dementia, which it's not a well-known disease now. It was even less well-known in 2011. And yeah, everything changed. And they said, you know, she could live 6 months or 30 years.
Wow.
Well, how do I plan that?
Right.
You know, so it was learning about that, it was physically exhausting because we always had to keep an eye on her. She did have wandering tendencies.
Did you move her to Florida?
She moved her to Florida, didn't know what the problem was, so we put her in independent living. That was a disaster. Then she moved in with us for just over a year, and because of her falls, I couldn't even run to the bathroom and not come back and find her on the floor. So I'm like, okay, it can't be just me anymore.
That had to be so frightening for you.
Yeah.
Because the roles were reversed. All of a sudden you were
Yes.
caregiver. So where did you find help? What was the first thing you did?
Actually, one of my first calls was to the Alzheimer's and Dementia Resource Center. I didn't use them enough, and I wish I would have, but
Why do you say that?
they offer so much, and I kept thinking, I got this. I can figure this out on my own. But that first call was somebody saying, it's going to be okay. These are some things you need to know. I remember it clear as day. I got the call in Publix, and he was just like, we're going to be here for you, and you're going to make it through this.
So what did they do for you that you could not do on your own? Because I imagine a lot of
yeah.
people say, no, I got this.
We all think we can do it. But, you know, as a parent, everybody's giving you advice. When going through this, nobody my age, none of my friends were going through it. So it was how to deal with each abnormal circumstance, how to get yourself in line legally, how to make yourself take a break, and just respecting how difficult it is.
How long did you care for your mother before she passed?
6 years in total, yeah.
If you could write a playbook for a caregiver, what would be the first thing you'd tell them?
The playbook is a good description because you need a team. It is not a solo endeavor. And I even actually had Team Joyce shirts made up because I was so committed to the team, because it just enabled me to focus back on being her daughter instead of this person taking care of everything. Once she was in memory care, I could go and visit and just have a good time with her and enjoy the time that we had left instead of thinking about laundry and meals and cleaning her up and all of that. So it takes a team. It really, really does.
And how did you take care of you? Because we've all heard the stories of the caregivers who get ill
Yep.
because there's no me time. There's no, I need to recharge my batteries time. So how did you handle that piece of it?
You know, I made some of the classic mistakes. I went a few years without doctor appointments of my own because I was spending my time taking her to doctor appointments. I was very smart and had a little miracle, and then I mentioned to my doctor at one of the last appointments before I started skipping, I said, well, now I'm a caregiver to my mom, and she's like, let's talk about a low-dose antidepressant.
Were you open to that?
I
or were you
was.
like, no, thank you?
No, I was, and I'm so glad I had it. You know?
What was the difference it made for you?
I didn't cry every night, right?
Yeah.
Yeah, I could focus because it's such, I mean, it's 6 years of grief as well. It was also 6 years of bringing joy to my mom's life, but the losses are just so constant. You know, the first time she can't remember your name, the first time she has no idea who you are, the first time she yells at you because she thinks she's been kidnapped. It's like every one of those is mourning that person who used to not do that.
So how in the world do you get through that and still find joy?
Well, you focus on what you have left. You can spend all your time being sad about it, but then once I could be her daughter, you know, I told the team, safe and loved. Those are the two things we're going to work on every day. And so it was like, what did she used to enjoy doing? Well, she was a huge sports fanatic. She never had to watch her teams lose anymore. We would record them on the DVR, and if they lost, they were gone, and she'd never have to watch it.
Beautiful.
So, you know, it was how can we focus on her? Sometimes it was just a chocolate chip cookie that would make her day. But, you know, she has a terminal illness. You're going to get a chocolate chip cookie, and that's fine.
I love what you said, grief and joy, and
Yeah.
they can coexist.
They
and they
can.
almost have to for
Yeah.
caregivers to make it through this process. Thank
Yeah.
you for sharing your
Oh,
story,
thank you
because
for
a lot
having
of
me.
people wouldn't.
Right.
Thank you so much. We'll be back right after this. Dementia. It's a scary word, but with education and support, not only from your family, but from organizations whose goal is to help you navigate this narrow pathway, you can focus on the joy and not the grief. We're here to always help you maintain healthy connections, and we're glad you joined us.